we're here with Jack Tsai, who is chairman of the Caucus on Homelessness. Jack, welcome.
Great, it's great to be here.
Yeah. Tell us a bit about yourself, your background, and how you came to be involved in the caucus.
Sure, yeah, I'm a clinical psychologist, and right now I'm the research director for the VA National Center on Homelessness Among Veterans.
Oh, okay.
The VA is the Department of Veteran Affairs.
Mm-hmm.
And currently I'm associate professor of psychiatry at Yale School of Medicine, Department of Psychiatry.
Wow, that's a very impressive background.
Oh, thank you.
Yeah, so where did you do your residency for psychiatry?
Well, clinical psychologists do an internship.
Yeah.
So I did my graduate training in Purdue, at Purdue University in Indiana.
Okay, good.
And then I went to Connecticut, New Haven, where I did kind of a one-year internship, which is kind of like a residency.
All right.
Yeah,
Very
so
good.
I've stayed there since.
Good. So how did you become interested in homelessness in terms of your career focus?
Yeah, I mean, homelessness is really a huge, major public health issue of our times.
Mm-hmm.
It's kind of a tragedy that in a lot of our civilized, wealthy countries, that homelessness still exists, and in some areas it's increased, the level of homelessness.
Mm-hmm.
Certainly in the U.S., it continues to be a persistent problem.
Mm-hmm.
I think during my graduate training as a clinical psychologist, I'm very public health focused, and so I was trying to understand the greatest needs among the population, and homeless adults in general seem to be some of the most underserved groups in society, and so I really wanted to try to apply psychological science and what we know about psychology to try to improve homelessness and prevent and reduce homelessness.
So at the keynote speech today, we heard the head of the Center for Disease Control in fact say that homelessness is a public health problem.
Right.
First of all, explain to some of our viewers who might not know, what is public health, if you could start with that.
Yeah, public health is a pretty broad term.
Yeah.
I think it often includes primary intervention at a population level, but also secondary prevention, where you're trying to capture those that have been somewhat affected by homelessness, they might be unstably housed, trying to prevent it at that level. And then once someone becomes homeless, in terms of public health, you want to intervene. And there's various public health interventions. For example, in terms of services, service models, supported housing for homeless adults is one that's been found to be pretty effective.
Now, most of us certainly think of homelessness, but we don't necessarily think of it as a health crisis.
Right.
So can you help articulate why yourself and your caucus and the head of the CDC think of it that way?
Yeah, historically, actually, homelessness has mostly been considered a socioeconomic problem.
Right, yes.
But as our understanding of mental and physical health has progressed, we've started to recognize that homelessness often is a proxy for a lot of complex medical and mental health problems. So a lot of the folks that we see that are chronically homeless, the vast majority of them have some medical or serious mental health issue. And so helping address that can often help address their homelessness and housing instability.
I see.
So now it's become seen as using public health solutions to address homelessness.
And you work with the Department of Veterans Affairs. Tell me a bit about the homelessness problem with veterans.
Yeah, so starting in 2009, under the Obama administration, ending veteran homelessness became a federal priority. So actually there's been tens of billions of dollars that have been invested into addressing veteran homelessness. I think the country recognized, especially during the wars in Iraq and Afghanistan, that it's a real tragedy when folks come back stateside and they have issues even maintaining their own housing, and they're being on the streets. And especially the lessons from Vietnam, we've learned we really have to have a public health approach to this. And so the VA has invested a lot of money in creating programs, also in research, which I'm involved in understanding what's the best time and ways to intervene in helping address.
What would you say the main causes of veteran homelessness are?
Well, I'd say some of the strongest risk factors are substance use disorders, and also severe mental illness.
Okay.
And it's kind of a given that poverty, being low income as well, are those three are kind of the the triad of risk factors.
And is that more or less the same as the broader homeless population, or are there differences with veterans?
I think it's mostly the same. I think there might be a slightly higher rates of post-traumatic stress disorder among veterans, given their higher exposure to military combat. But that's not to say a lot of homeless adults also have a high rates of exposure to trauma, victimization. Being on the streets can be very traumatizing. But in general, the risk factors are similar between veterans and non-veterans.
Tell us a bit more about the caucus for homelessness here at APHA. Explain to folks what a caucus is and when it started and what the focus is.
Yeah, so I'm the chair of the Caucus on Homelessness, and caucuses are kind of a unit that are affiliated with APHA, but they're also independent. So they don't receive any direct funding from APHA, but at the same time, they serve some special interests that are well aligned with the APHA mission. So there's kind of advantages and disadvantages with that. But the Caucus on Homelessness has been around since the 1980s. So it was established in 1980. We're one of the largest caucuses in terms of membership.
How many members do you have?
The latest count was 420 active members.
Wow.
So I welcome folks to join our caucus.
And your typical caucus member would be somebody who works in public health and focuses on homelessness.
Right. Yeah, we welcome anybody that's really interested in homelessness, but a lot of our membership includes providers, researchers, sometimes administrators and policy folks as well.
I see. And are there particular places in the country where homelessness is unusually significant as a challenge, or is it widely distributed?
No, it's definitely geographically geographically uneven. So I think the major places where there's the highest rates of homelessness are in California and New York, and that continues to be a problem.
That's New York City or New York in general?
New York City, particularly New York, particularly New York City, and these are also the places that have often the very high income housing, which kind of exacerbates the problem because then there's lack of affordable housing, and so there's not only high rates of homelessness, but there's difficult pathways to address homelessness because there's lack of inventory for housing.
And what are the main activities of the Caucus on Homelessness? Do you sponsor research, or what is your main focus as a group?
Yeah, so we have, I think, multiple causes. So we have the programming that we do for the convention, where we have our own programming hours. We have our own poster session, and during that time, we also recognize some excellent folks that are in the field. So we award a clinician or a researcher every other year. We also give a student award. So we recognize those folks during convention, and then throughout the year, we try to have we have a listserv. So we have regular interactions with our members through the listserv, try to share whether it's job posting, or maybe recent news and activities. And we have some various social media outlets, Facebook, Twitter. We're also doing that. So and in general, I think we're trying to, create a community for people that are interested in homelessness, to share ideas, to be a resource for them.
And as an assistant professor of psychiatry at Yale, what is your focus there, and what kind of research are you working on?
Yeah, so at Yale, as an associate professor, I have my own lab, and we do a lot of work on homelessness or related homelessness, helping low-income populations. I do quite a bit of work also on trauma, which also aligns with the VA.
I see.
So we try to understand the phenomenology, post-traumatic stress disorder. We've done quite a bit of work on post-traumatic growth, so kind of positive psychological experiences that people are going to have after trauma. But in terms of homelessness, it ranges widely. We have some epidemiological studies trying to understand some of the geographic differences we've spoken about, some of the risk factors, but also we have some interventions that we're developing. For example, we're now trying to develop an intervention to help people manage their money, money management intervention, helping people improve their financial literacy, learning how to build credit, how to start a bank account, which unfortunately some people just haven't really been gotten good knowledge about, good information about.
So it can just be one of the factors,
Right.
lack of education on personal finances and
Right.
things like that.
Right. Yeah.
Interesting. Anything else you'd like to add?
No, this is, thank you for the opportunity. And again, if people are interested in joining our caucus on homelessness or working on research related to homelessness, people can feel free to contact me.
Terrific. Thanks.
Thanks a lot.
Nice to meet you.